All right. Well, good morning, everyone. Thank you so much for being here. My name is Mike Jackman. I am the chair of South Shore Community Partners in Prevention. And I thank you all for being here today. We're still obviously meeting on Zoom, which I think has actually boosted our numbers a little bit. So I think if we took a longitudinal study since March of 2020 of our attendance, I would say probably on average, it's a little bit higher than it might have been before the pandemic. But hopefully soon we'll be back in business and back in person. I will say this is sort of a coming attraction, but our annual meeting in June, we are planning to be in person as we have been for the last 2 years, I believe, for our annual meeting. And that'll be, I think, June 14th, we said, Kim, that second Wednesday. Yeah.
Yes, that's right. Yep.
So more to come on that. And we have another announcement about that at the end of the program, but I wanted to make sure that we get to all of our speakers before we do that. The first thing we need to do, and I'll just ask folks again, if they're just logging on, if you don't mind putting your name and where you're from, what organization or who you represent in the chat. And if you are not on our email list and you'd like to be, please do put your email address in there as well. But we just have to take care of a little bit of administrative business. Kim takes the minutes every month and sends them around. So just to make sure we're keeping it legal, so to speak, could I get a motion to approve the February minutes? Kelly, thank you. Is there a second? Karen, thank you. Is there any discussion? All those in favor? Opposed? Motion carries. Thank you very much. Okay, getting right into it. We have a lot of speakers today, so I want to give them as much time as possible. Over the many years that Chennai has been active, we have been able to give grants and share resources from the determination of need process with our communities through our mini grant, health literacy grant, and behavioral health grant programs. And we like to have those folks come back and tell us what they did with the money and what kind of success, what kind of challenges, and learn a little bit more about their program or project. So today we're very happy to have Elizabeth Torrent with us from Health Imperatives. She's the Chief Program Officer, and she's going to talk about her grant, the grant that we gave them on Survivors of Violence Social Marketing Initiative. So Elizabeth, I'll turn it over to you.
Good morning. Thanks, Michael. And hi, everyone. I think Nancy DeLuca from our Plymouth Sexual Reproductive Health usually attends these meetings. I don't know if she's able to come today. No, she's in clinics a lot. So I am I'm going to be presenting, and thank you to the Chennai, to CCPIP, I think as I call it, for the grant. And I'll share and welcome questions. Let's see if it's going to let me share my I have oh, can someone give me capacity to share? Sorry.
Okay, I thought I did, but let me just
host disabled, participant sharing. Let me try. Share screen. I just put a little PowerPoint. Let me see. Oh, no, it says disabled.
Okay, try it now. Sorry about that.
Okay, that's all right. That looks like it may work. Let's see. I want to share my. I'm just trying to find my. That's not helping you much. Can people see this?
Yes.
Oh, good. Okay.
Awesome.
All right. So I'm going to run through this. I know I have about 5 minutes. I talk quickly. That's a good and bad thing. So, so I'm going to run over just a lot of you know Health Imperatives, but our mission, we serve all of Southeastern Mass, Cape and Islands to improve the health and well-being. And these are our 4 main areas that where we provide services: medical services, maternal child health, and child health, housing and security, economic security, clinical emergency services. So the grant that we were awarded and worked on was under the Clinical and Emergency Services Sexual Assault Program. You don't need to see that. It's just where we serve, our priority populations. I'm not going to read it all to you. Hopefully you guys read fast. And our approach, how we provide services. We provide a lot of different types of services, but what we have in common across our service area and across our programs is the way we intend to provide services, internal referrals, external referrals, working with community partners, being trauma informed, free or low cost. This program that the sexual assault program is a free program to anyone. Doesn't matter income, race, anything. It's free. We get state funding for it. We do health navigation. We collaborate. Get input from our clients. This is the program that we for the grant fell under. So it's a sexual assault program. Counseling, support, advocacy. We do medical advocacy. So if someone calls the hotline or goes to the hospital for a recent sexual assault, they know to call us as the rape crisis provider, and we will go out and meet a client at the hospital, help support her, usually her, sorry, any gender, through the process. And our programs under survivors of violence is the sexual assault program, our court-based advocacy program in Plymouth, where we provide in the courts, work with clients to get harassment and restraining orders. We have our domestic violence shelter, and we have a human trafficking unit. So our goal, we were awarded $5,000, the grant to improve knowledge of our prevention services and strategies, increase access to our sexual assault program for vulnerable low-income families and individuals. We wanted to reach 10,000 people utilizing a variety of health literacy principles, which included not just information about a service, but some education, and provided in multiple languages, because our target priority populations are people who have struggled to access services for various barriers, including language, trust of systems, knowledge of systems, lack of knowledge of systems. So we created a number of multimedia materials, including a radio ad, a bus posters, flyers, cards, social media posts. We provided outreach. Pulling off from the grant report, what we were proud of is that we did manage to develop a number of ads, which I'm going to show you, in different languages. This is an example of our one of our Facebook ads. So it talks about who we are, how to reach us. And there's just multiple ones. So because we kept changing them. The fee. So I know I don't have a lot of time. This was a flyer that was posted in 3 languages. I don't know if you can see it. Let me see if I make it bigger. I'm not sure. But the services that we provide under the grant, always with our hotline, 24/7 hotline for anyone to call. You can be a victim, you can be a family member, you can, anybody wanting to know at 3 in the morning can call our hotline. And then we did some digital mobile ads this is again, sorry, it's probably a little small. I did my best. Look like this, and then where we were, directions, just a call. Then we developed cards, 3 cards that all had support, believe, and empower. It's our message on the front of them. And then the backs of them differed. Again, we kind of changed it up. All services free and confidential, what the services were. Information, this is part of the health literacy, is helping people know what to do after an assault or family member or a friend, anybody that can help people like figure out, next steps. Obviously, people in trauma, they're often, paralyzed of what to do. So this is just sort of easy steps. And then another informational on the back is, just starting some information on what's a healthy versus a toxic relationship. Stuff you guys probably already know. This was the bus ad. So it was put on the buses and look like this. Again, same information, maybe it looks a little different. obviously we had help with the companies to help us design something. And then I'll just want to go through the measure of our outputs. So this is kind of an estimate. Some of it we know exactly, but through Instagram, the marketplace, mobile Instagram videos, for the first half of the period, we reached 5,912 people. That means it went 5,912 people had the opportunity to see it. It's a strange measurement. Doesn't mean that they did anything about it, but we get a little more information further down. Oh, sorry, I have a typo over here. We reached 1,500 people through the bus posters, 2,000. This should have one of these there. 2,000 people through our social media posts. And this is hard to exactly measure, 1,000 people through flyers and cards, which we just showed you and developed and distributed widely to community partners, waiting rooms, community areas, given to people. The Facebook ads. Here's where we can see that 51 people engaged in the post, actually did something with the post, 10 people reacted, 64 clicked. I'm gonna move you guys over here. The links that took them to our service page of these. This is just the demographics, 60% female, most of whom are in the 25 to 44 range. And then this is then second most would be this range, third, and then fourth. We did the radio ad, and we participated in multiple collaborative meetings, including some of you all. And we implemented a 1-month campaign on the PLM radio. And this is, I tried to put it into this so I could play it, but not that good. But this is what it's basically said, very basic. We offer free services for survivors of sexual assault, domestic violence, and human trafficking at 123 Camelot Drive. We provide crisis counseling support groups, court and medical advocacy, and connections to community resources. Call us. Of course, we have to spell out the phone number. And just as a client story, this is someone who called us. She had a past sexual assault. So we see people who have a recent sexual assault. We'll see people who have, it could have been assault any time in their life, but it is hitting them now, or it's impacting them, or they just realize that they didn't get help, or they continue to want to get help. And this person had a past sexual assault, but she was also in a dangerous home situation. She had severe anxiety, isolation, and was experiencing physical and emotional harm. She, in the first, like the intake, she identified she had financial concerns, food insecurity, unstable housing. I mean, obviously, lots of people have lots of issues going on. It's usually not just one. Unstable housing. She was in a sexually exploitative relationship. Lack of resources due to her status as an immigrant were creating barriers. So we worked with our connector to our additional health imperatives programs. Also, the South Coast Community Foundation funds to help people with emergency needs as a result of COVID. Often we were able to support and get her out of her house, provide counseling, and get her out of her isolated experience. Today, we are no longer seeing her, but her anxiety has significantly lowered. She was no longer isolated. She was free from that housing situation. So that's just an example of a client who came in under this grant, but also other needs, and how we are able to connect to other resources and always partnerships, because we couldn't do any of this alone without our partners, including you all. I would say lessons learned. I hope I'm not going over. It was a lot of work. We fully evaluating a small scale social media campaign was a little difficult. So we met our deliverables. It is expensive. I call it a social marketing media campaign, but it was a small one. We continue the radio ads because we felt it was so important. So we put a lot of in-kind money into that was beyond the grant. We reached a lot of people. It's hard to quite measure if, and this is just honest like evaluation, if this campaign impacted the people who are coming in. We saw 58 people in the year from mostly from Plymouth, about half from Plymouth, and then surrounding communities that came in for sexual assault services. And we reached another 113 people through outreach, like at MAP Academy, providing education around sexual assault, healthy relationships. And so I think probably my lesson learned is looking at it maybe in a narrower way to do evaluation, to really see, like, we do have demographics and who we reached. Again, as I said, of the clients, most were females, the great majority, a few males, 2 non-conforming genders, 2 unknown genders. We reached 8 under 18, 11, this is actually the 11-month data, I didn't update it, 11 between the ages of 18 to 26, 24 between the ages of 27 to 59, and 4 over 60 who came in for the services. 43, almost half spoke English, a small percentage spoke Portuguese, Creole, and Haitian Creole. So we were able to measure that. So this is good because we can now look at that compared to next year. I'm trying to think if there's anything else. Yeah, it's expensive to really do. I think a big campaign would be a lot more of investment, but this was a great experience for us and to get our information out there. And we hope it has longer lasting effects. So getting out into the community, showing this to you all and making sure people know, because it's really the partners, the people in the community who know how to support a client if a client doesn't know the next steps. So we hope to still see the outcome of this in the following year. I don't know if I went over my time. I didn't chime myself. So does anyone have any questions?
Yep, go ahead. Debbie, you have a question?
I just have a question on connecting these folks with coverage as far as, insurance, either Mass Health, or Health Connect, or any other services like that. Do you have staff that do that, or do you have referrals out to your community?
We do. Although this service doesn't need insurance, we also know that a lot of people, really about half the people we serve don't have insurance, meaning they either literally don't have insurance or they're underinsured. Maybe they're only on, because of their status, maybe they only get catastrophic Mass Health. So we are working with a new partner, Health. Oh gosh, I just met with them yesterday. They're on the Cape, and they're lawyers who actually taught us something about immigration status and who is eligible for what. And a lot of people don't know that it's more than just Mass Health Limited. So I'm finding out more about that. But we also have certified application counselors in our programs who rotate to help people, and we refer to other, there's other people in the community that offer that service. So important. Thank you. That was a great question.
Yeah, because my department works with training of certified application counselors, so I was just curious if you had them on hand. So that's great. Thank you.
We have harm reduction specialists in all our sexual reproductive health services too, and they are all either trained as CACs or going to be trained, and then they work really closely with our sexual assault program. So
that's great. Thank you.
It takes a, you know what?
Yes, absolutely.
A dream team, the village.
Any other questions? And we'll make sure we get these slides, especially with all the contact info.
I have mine in here.
Yeah.
Yep.
Elizabeth,
please.
thank you so much.
Thank you again.
Yeah.
Let me stop sharing. How do I stop sharing? You are screen sharing. Stop share. Okay.
All right, great. Thank you so much.
Thank you.
Okay, so our major theme today is mental health. And actually, this is also going to be, we had a 2-part meeting panel on housing for January and February. And this is going to be a 2-part panel as well on mental health, but it's going to be March and May with kind of a little break in the middle. So we're very pleased to be able to address this. I was chatting with Karen Peterson yesterday from BID Leahy Hospital, and they have just are in the process of going through and finishing up a community health needs assessment. And mental health and housing are emerging as two of the main issues, which we saw when we heard about the community health needs assessment last year. So we're very happy to have some speakers today who are going to address some mental health projects and programs. And our first speaker is Judy Duarte, who is a nurse educator at the Plymouth Community Intermediate School, if I'm correct. And if I'm not, Judy, please correct me. And you have a special guest with you, so I'll turn it over to Judy.
Good morning, everyone, and thank you all for being here. So yes, I am one of the nurses here at PCIS. I'm also a pediatric nurse practitioner, worked as an NP for about 25 years, still practice per diem, but did that before I came over to PCIS. This is my 6th year in this role. So I have Ace Madrigali with me. She is one of the students. She's 7th grade student here, and she'll have a great opportunity to speak as well. But she is one of the ambassadors of the Yellow Tulip Project, and that's what I wanted to just share what we're doing here at our school. So for those of you who may have never heard about it, the Yellow Tulip Project, it's a nationwide youth-driven movement with the main goal and mission to eliminate the stigma surrounding mental health and to get people, particularly young people, to talk about their mental health when they're struggling and to get them help and therefore spread hope, and not just within schools, but within communities. So I found out about the Yellow Tulip Project a few years, 2 years ago, when one of my good friends lost her 17-year-old son to suicide. He died by suicide. This was a loving family, 3 boys. This child, Matthew, was my own son's age, and we've known him since he was an infant. And he just struggled with mental illness. There was no significant trauma that happened. I think sometimes people have different theories as to why somebody might die by suicide, but you can't, as most of you probably know, you can't tell just by looking at somebody who's struggling. You can't isolate a certain family dynamic. It just happens, and I think all of us at some point will be affected by someone who's struggling with mental illness, and it doesn't start when you're 20 years old. It starts when you're a child, a teenager. So the earlier we can get children and young people to talk about it and to get help and to not lose hope, that's our mission, our goal. So the Yellow Tulip Project was founded by woman, Suzanne Fox, and her daughter, Julia. And so they are from Maine. And Julia had lost 2 of her best friends to suicide when she was 15, both within a month of each other. And she came to her mom. She herself was struggling from depression and said, we've got to do something. What is going on? Why are young people just losing hope and thinking that there's no way out? And they started the Yellow Tulip Project. So out of her 2 friends, a tulip was one of her friend's favorite flower. Yellow was the other friend's favorite color. So thereby the Yellow Tulip Project was created, and it has exploded in a really positive, great way. So I decided to bring it to the middle school level. I was one of the first. You were the first in the district. I was the first person in the district, but I was probably one of the first educators to bring it to a middle school level. It was typically run at a college or high school level. And as a pediatric nurse practitioner, prior to even coming here, I see the mental health in my office. I see it as a PNP in primary care, and I had seen it increasing gradually over the last probably 10 or 15 years. And then I definitely see it here at our middle school level, the rates of anxiety and depression, and then you throw a pandemic into it, and there's a lot of children struggling and a lot of families struggling. So it's all about, like I said, spreading that message. So what we do here is we have a team of about 8 wonderful, awesome kids that are our ambassadors. And part of this whole mission is creating Hope Gardens. And so last year we planted 500 tulip bulbs around our school, and they were amazing when they came up in the spring, just such a positive image. And this year we spread to our community, which is what we want to do more and more. And we planted 300 tulip bulbs at the Plymouth Public Library. And we brought Plymouth North High School into it. They now have a chapter, and Plymouth South Middle School also has a chapter. Two of my friends and colleagues work there, and I think I talked about this so much last year that they wanted to be a part of it too. And we do a lot of other things, but I'm going to let Ace tell you a little bit about what we do within our school.
So, hi, I'm Ace, and I love being in the Alien Movement Project, and it's a project very close to home, as I lost my father to suicide, and I love being in it because it gives me a chance to be involved in my community. And so recently, because it's March, we're doing our yellow tulip tree event, where we have tulip trees and they have little yellow tulips on it. And we bring in donations, and they're donated to the Franciscans Children's Psychiatric Unit to struggling teens and adolescents with their mental health. And they go out at the end of March after we collect all of our donations that include blankets and stuffed animals and coloring books and sketchbooks and puzzle books and all sorts of good things like that. And they go out to the kids. And so that's a great thing that we do. And we put on our hope gardens and we paint kindness rocks in the beginning of the year. And sometimes you do it in the spring, and they're yellow and they go around our hope garden. And they're just, it's a positive upbringing, and it makes you smile when you see them. And you can definitely see the impact that the Yellow Tulip Project has on the school when a kid walks by one of the billboards and they smile, or you see them kind of writing something down when they walk by them. The Yellow Tulip Project, I think, has an impact on the school community, the town community, as we planted a garden at the Public Library in the fall. And it's a project, and it brings people together, and it smashes the stigma. That's our saying. It smashes the stigma. It definitely, you can see it doing that. You can see more people talking about it. You can see more people being willing to communicate about their mental health issues.
And throughout the year, so we meet just about every week with our 8 ambassadors. It's myself and Lori Rush, who's our school psychologist. She also helps me with this project. So we typically meet after school on Thursdays. And obviously in the fall, we are really busy planting all those tulip bulbs, getting the gardens ready. And then as we progress into the school year, we offer different activities. So there are some activities that we try to open up to all the students, whoever would like to participate. And a couple of those are like the rock painting, like Ace just mentioned. We also had the Hope Day Walk was last year, which I'll tell you how we're doing that this year. And then we also had a yoga afternoon. So also giving kids tools and skills and helping them see how important exercise and taking care of yourself mentally and physically. We just had a heart healthy walk in February. Again, just to say we take care of our hearts physically by moving, but also how important movement is to our mental well-being too. Get out, exercise, be one with nature, feel the fresh air in your face, all of those things. Try to help kids realize the connection between the two. When we meet weekly with the students, we do some journaling activities, and it's a small group, so we're able to kind of share a little bit more in just a closer fashion. And so Ace mentioned the Hope Day Walk that we did last year, which was small within our school, and we had Ansel, our therapy dog, come because the whole theme was tails and tulips and how important animals are to help with our mental health too. And this year we are bringing it into the community. So we are sponsoring April 29th Hope Day Walk, and it's going to be right before the Wellness Fair. And it will be at Plymouth North High School is where we will take off, and we will do a small 1-mile walk, loop around where the tulips will be at the library, and then come back. And there will be some tables of resources. And again, it's just getting that message out there. Like, we're here, look at these beautiful tulips, look at the positive things and how we can bring this positive light to our community. And that's a lot of what tulips are all about. When we plant them in the fall, we talk to the kids about, you plant a bulb and the bulb stays in the ground through the difficult and cold and awful winter sometimes but they come through. And that's our message, that no matter how difficult times are, sometimes no matter how awful life may seem or whatever you're going through, hang in there and have hope and push through, just like the tulips do, and something beautiful comes at the end. So that's our message, and we hope we get a lot of people out for the Hope Day Walk on April 29th. And that's a really quick synopsis of what we do. And we just want to see this spread, the more people that get involved. I do want to do a little shout out to Karen Peterson, helped me receive a generous donation from BID Plymouth so that we could have some items at the Hope Day Walk in April so that we can pull this off, because like you all know, you need money to get any of these things started. You need money to buy the tulip bulbs. The things that we do on a more local level in the school, we try to do as much as we can with the funding that we have, but I did receive a a small grant from the Plymouth Education Foundation, and Egan Landscaping came and helped us prepare some gardens. So, and Home Depot donated mulch. And so we have definitely had the community help out, and we really appreciate everything that people have done for us.
Great. Thank you so much. And I think we have a flyer for the Hope Walk. Is that, did I see that, or did I imagine that, Kim?
I did send that over to Kim. I
Yeah, I
can also
do
put it in
have
the
it.
chat if you want.
I can blast it out afterwards if that's okay, Judy,
Yeah.
with the video too that we shared on the Facebook page for this group, which was really cool.
Absolutely.
Thank
Great.
you.
Well, Judy and Ace, thank you so much. Does anyone have any questions about this? Do you know of are there other yellow tulip projects in other schools in our area or region that you know of?
In our area, I was the first in our district to start it. And then so this year, Plymouth South Middle School has a group headed by Colleen White and Stacy Strassel. And then Plymouth North High School has a group headed by Laura Wilson. So that's it for Plymouth. And I actually will be in a call with a principal in Quincy, because he wants to, it's all word of mouth, you know,
Yeah.
and once you start talking, then someone else says, hey, that sounds great. I want to bring it to my school. And I'm actually presenting at a National School Nurse Conference in Florida in June. My abstract was accepted, and I'm speaking to school nurses of how you can bring this project to your school. So hopefully it continues to spread. It is in other middle schools and high schools in Maine and throughout New England mainly, but there's only one other middle school that's been involved, and that's in Maine. So yeah, last year, everything that I had done in our school helped create a middle school roadmap and curriculum, which is now available through the Yellow Tulip Project for anyone who wants to start it at a middle school.
Awesome. That's great. And I see Jenny Babcock put in this the chat that Fontbonne Academy in Milton has a Yellow Tulip project as well. So
Yes,
Right.
actually, they were the representatives that I met at at an event in memory of my friend's son. And that's how it all started. They had a little table and I asked them, what is this all about? And then I connected with Yellow Tulip Project on their Facebook page, and it just exploded.
yeah. Well, like Elizabeth said in her presentation, it's all about networking and making connections. So that's awesome.
Yes.
Thank you so
for your
much.
time.
Any other questions, comments? And we'll make sure we get that video out in the flyer for the walk, the Hope Walk on April 29th. That's great. Thank you so much.
Thank you. And I'd love to stay on, but I am at work and Ace needs to get back to class. So I do need to. stay on.
Ace could probably get credit just for listening to all the wonderful things we're going to say. So
Yes.
we're educating each other. This is great. Thank you so much for being here and taking the time. We appreciate it.
Thank you very much, everyone.
All righty. Okay, so we're very pleased to have a presentation also on the theme of mental health that I think it fits in with what we just heard about about the Yellow Tulip Project from Paul Gabriel at the Plymouth Suicide Prevention Coalition. We were very pleased back when the Liz Hahn health literacy grants were a little bit more, our finances were a little bit more robust, and we were able to make grants to give a grant to the coalition to get train the trainers and get some training And we're really excited to hear about that and all their programs and sort of what the coalition is seeing in the area of mental health and their work in suicide prevention. So I will turn it over to Paul. And Paul, just let me know when you want me to share the screen and I will do that.
Okay. Finally got my camera up. Thank you, Michael, for asking us to be here today. Obviously an important topic for us at the coalition. We are heading into our 9th year come June with the coalition. The Suicide Prevention Coalition, which started because the rest of the state was covered with coalitions and trying to get education on mental health and suicide prevention, to our communities. Plymouth did not have one, so a bunch of us got together 8 years ago and kicked it off. So we've had a lot of good partners. I see a lot of familiar faces that I haven't seen in a long time on the chat. So hi to everybody that that I haven't caught up with in the past few years. But thank you for all your support and partnership behind us. Thank you for the grant from Chinar that helped us get 2 trainers going with what we think is one of the most important trainings that we can offer in our community, which is called the ASSIST training. It's applied suicide intervention skills training. It's a 2-day training, pretty intense, teaches people actually how to do an intervention. So the grant allowed one of us to get recertified and one of us to become a trainer for that program. So we appreciate that that funding. Since then, because of COVID, we weren't able to launch the training out in our community right away. It is not one of the trainings that we could adapt to a virtual training, nor did we want to, because we don't think it would be as effective as it is, in that 2-day training. So we were a little delayed in getting it out to the community. We did do our first one a few months ago in Hanover. It was well received. We had some money from the grant also to offer scholarships to several, several people that have helped us out along the way. So we were able to give, I think, 8 scholarships. Jenny, you can jump in at any time if I'm incorrect on any of this. I think we gave away 8 scholarships still with that grant money. And you got that right?
Yeah, the
And-
scholarships were written into the grant. So that's why we offered Chinar 2310 and 8 people took us up on it, which was great.
Excellent. So we also got a donation from the Casey Project that allowed that entire class to be free for everybody, which is excellent. I mean, out of all our programs that we offer to the community, we'll go over some of the more, popular ones that we would deliver. But out of all of the stuff that we offer, there's usually a cost involved. It's an expensive class to run. That cost can be anywhere from $250 to $400, depending on venue, materials, how many participants we have. So we were really pleased to run that training free for everyone. So that was great that we received that grant, and we appreciate it. So what else we have, Jenny? So that's just me. You don't have to know much about me. Jenny and Laura, I have 2 co-chairs that run the coalition. They do a wonderful job. Their information will be available if any of you do not have it at the end here. You can contact them. They do great work coordinating all the stuff that I do. So, and it says original founder there. I just reached out to the community and asked for people to come. And that first meeting, we had over 50 people. So really, we found it as a group, not an individual. So everybody's been working hard throughout these years to keep it rolling. And we've really been able to touch the community in several ways. We infiltrated, and I use that word because it's the way we have to get into our school systems. It's tough getting in there. So we've infiltrated most of our towns in the entire Plymouth County. And there's still a few that we're knocking on their door and we get a little resistance from, but we've been pretty successful at getting in most of them and setting up trainings for either staff or students. So that's worked out great. We've been able to work with the military in our community, our veterans groups. We've trained, over 400 police officers in a mental health training, along with some fire and EMT mixed in those classes. So we've been successful in getting out there, and we just want to really, be able to continue to do this work and share our thoughts and what we can offer with you guys. So, so moving on. So what we offer here, we offer a lot of things in the community. There's a lot of work behind the scenes that Jenny and I do, beyond just these trainings that are listed there. And along with these trainings, there's probably about 5 more trainings that we can offer. The ones that aren't listed here, the ones that we offer free to the school systems. For our students, we have a couple different programs. They're tough to get in there, and they're tough to give us the time. But again, we really think that mental health, especially in the last few years, even before the pandemic, that the mental health, not epidemic, but issues that we were seeing in our youth has increased, partly because of the pandemic, but just the way the climate and changes that are going on in our society. So we would like to get in there and offer more trainings to the schools and get the trainings to the students, not just the staff, starting, in middle school. It's really so these kids understand as they, go through middle school and high school and off on to college, they understand what mental health is and how they can help others. I love that, the Tulip Project there, the Yellow Tulip Project. And I think Judy said she had to leave, but I'm glad that she's got that rolling. And then I'm going to contact her and see if we can work together getting that out to other schools. I noticed that somebody put in the chat that every school should have it. And I believe that would be a great way to get into the school with positive mental health, thoughts and teachings for these kids. So that's great. So, but on those other trainings, the trainings that we offer there, the biggest that we're doing, if you go back just one slide there, the mental health first aid classes, there's about 7 different modules that we work with. And that goes with first responders. We have it for elder services. We have it for school personnel, military. So there's a handful of different mental health first aid classes that we run. It's probably our most popular one that we run and the most that we can offer throughout the year. It's a full day class. It's 8 hours to take the course. It is a free course to the people in our community. So we probably, run at least 4 or 5 more by the end of this calendar year, and hopefully get 1 more in before the end of the fiscal year. So, that's probably our one that's just easiest to deliver, and it's great information for learning about mental health and how to help someone in a crisis. So that's the one that we prefer to offer to the community, and it's been kind of adopted all around the United States. So it's well known and well versed, and people are using the same language learning about mental health. So that's great. The other one there is the assist, the one that we use the money for the grant to get up and running. We'll probably do at least 2 more by the end of the calendar year. I would like to get 3 in if possible. Again, that's probably the most intense training we have, and really teaches someone how to do an intervention with someone that's suicidal or in any mental health crisis, really, once you've learned some of those skills. So that is one that Jenny and I will be working on setting up within the next couple of months. So if there's anybody that's interested in that, or people that you work with that you feel would benefit from that training, feel free to contact Jenny or get on our list for our flyers when they head out for those trainings. What else do we have, Jenny? We'll go one more slide there. So yeah, just all the trainings that we offer, they're all evidence-based. It's all work that, is at the top of the field with either suicide prevention or mental health. And, again, it's really that we want people to use us. We offer these trainings to get knowledge and education, to our community. Again, all these trainings are free. So we really just wanted people to, knock on our door, let us in as we knock on theirs and get these trainings up and running. And so that's the meat of what we do. We also are there for crisis situations. We work kind of behind the scenes with families that have lost around suicide or any tragic death in the community. So, we can be reached out for that. And then there's just, a variety of other services that we can provide. Jenny works with a veterans group. She's on a radio show almost every week out of Marshfield, talking about mental health and suicide prevention. So, there's many services that we offer, and we, have done a lot in collaboration with a lot of you that, are on this call and a lot of the other agencies in the area. I think it's a team effort for all of us to do this. We're not out there on this, crusade to be, the best, but we want to do the best, and we want to, partnership with your agencies and anybody that, might have some sort of in or connection with other agencies or school systems or, town services where, we can provide, what we've been doing for 8+ years now. And so Jenny wanted me to mention, she worked hard on getting CEUs for, for the couple of trainings that we do, the two big ones. So that can entice people to come to the classes. And not that it wouldn't be worth it for them without them, but an added bonus is always nice when you need them. So that's something new that we'll have. And I think we just have it now. Is that for social workers, Jenny? And we're going to work on having it for teachers and some other professions. So we're just slowly picking away at that.
Correct. It is just for social workers. There's all different things I have to fill out for each level. But even just to get these two, it was a lot of paperwork, but I'm very happy to have them.
Excellent. So with that said, again, I just appreciate all the work that everybody's doing. Everybody that's on this call and all the collaboration that we've done over the years with you. Off and on, some of you I haven't seen in a few years, but we're always here and are willing to work together with you. So I thank you all for the hard work you're doing. And I don't know if Laura's on the call, my other co-chair there, but thank you, Jenny and Laura, for the work that you guys are doing. Also, the suicide crisis line, which used to be an 800 number, recently was changed to 988. So it's easier for someone to remember that might be in crisis. And, kind of like dialing 911 for emergency. We have 988 now for the suicide crisis line, which is awesome. Just, one simpler step for someone that might be struggling and an easier way to reach out. And as it says there, effective in July, there'll be 5 call centers in Massachusetts. Already effective last year in 2022 was 5 call centers in Massachusetts. So we're on board with that. That's great. That's it. There's Jenny and Laura's information if you need to contact us, also with our email address. So again, use us, as I say, use and abuse us, because we want to be out there and, whatever we can do, just, we like getting into the community and sharing the information that we have.
Thank you, Paul, and thank you, Jenny. And we certainly will make sure folks have all this contact information. a question about the CEUs. And this is sort of a preview of an announcement we were hoping to make at the end of the meeting. We working with the Greater Brockton Chenal and with the Mass Community Health Workers Association to do a convening of community health workers in our regions for the end of April. And in our discussions with Matchwa, the Community Health Association, Community Health Workers Association, I'm sorry. I believe there are 10 core competencies and they're working on an 11th, which is mental health. So I wonder if those, if I can go back with the slides here, the continuing ed CEUs, would they be applicable for community health workers? Or is that something that maybe is another level of paperwork that you'd have to go through?
That I'm not positive on, but I can definitely email them because I have had a couple of questions. People keep getting different initials after their names.
Right.
And, you know, basically it is social workers as long as they're approved through their corporation. But I can get clarification on that and get back to you, Michael.
Okay, and we can check in with the Mass Community Health Workers Association too, because I know that so it's I believe it's not a core competency now, but they're trying to add it. And they have a whole accreditation certification process through the state now. So like you said, a lot of paperwork, but I did have another question. I don't know, I'm going to stop the share. So if folks have questions, they can let us know. The different trainings that you offer, is there one that if you are able to work with students directly, is there one that you would, bring to the students that's maybe more like a signs of suicide or things that kids as peers can look out for? I just didn't know what the thinking was around that.
As far as, you mean the age of what somebody can do?
Yeah,
Like,
well,
what programs?
I guess the basic question would be, if you were to have a program for students, which training would you do, and what would be the things you'd want to emphasize?
So the high school students are old enough to do the Talk Saves Lives training, or the QPR training. Both of those are a suicide prevention 101. It's an hour. We like to have an hour and a half for a little extra time. Does touch on signs of suicide. It touches on, things to look out for in their friends or their family. It is a basic training. And we put that out in the community on a regular basis, just to give some people some interest and some knowledge on suicide prevention. And then usually that turns into, more people wanting to take the other courses to learn a little more about mental health. There are programs that we also have through AFSP, which is the American Foundation for Suicide Prevention, that we deliver in the school system. The one we use the most is called More Than Sad. And that's a program that gets, it's good because it has to get the staff involved and it gets the parents involved as well. And then the students, we show them a film, we talk about mental health, we talk about suicide ideation. And not only is it good for them to learn about it, by showing the program and using the school staff in the room while the questions are going on, while the film is being showed, it's easy for us to watch students' body language, movement, talk, things that we can look out for, and puts up the red flags around some of the kids. And the kids aren't approached in the group, the school personnel or the school psychologist who's ever in that room, just takes note of it and approaches that kid on a separate time to check in with them. So that's the most popular one we use.
Great. And I guess I would just say that I think one of the things, you talk about stigma. Obviously, there's a lot of stigma around suicide and talking about it. And I think sometimes people are afraid to talk about it because they think they're going to say the wrong thing. So that's why I think these trainings are so important. I see, Jenny, you just put in that there's a QPR at Pembroke Library on the 20th. Are we from Monday?
Correct.
Yep.
And I think just going through even like a meeting like that, even if you only go to one session or just to get the notion that, you know, talking about it's not gonna cause the suicidal ideation. It's so important to erase that stigma and get beyond those that initial fear, I guess.
Yes, one of the basic programs there, the Suicide 101, so to speak, is the one called Talk Saves Lives. Kind of the title says it all there. It's not talking about it that is that makes it worse for people, that they don't feel it. They, you know, like you said, the stigma that's around it, that they can't open up when they're struggling or talk to their family or friends about it. So just talking about it is actually lifting the stigma. In society, we're doing better with it as a whole. We have, you know, stars that are coming out and speaking about it. We have lots of, you know, up and coming musicians that write songs about mental health that the kids are, you know, getting into, and it's starting conversation. So yeah, it's really, it is, even those basic programs just gets the conversation going. We did one last week in Scituate, and, you know, and it just got the ball rolling with people that thought the opposite, you know, the myth of that if you talk about it, you know, it's a bad idea. So yeah, so you're right, Michael. It's just getting out there and starting the conversation and allowing people to talk about mental health.
Great. And Jenny, if you have a flyer on that program, if you want to forward it to Kim or I, we can definitely get it out.
Yeah, I can do that. We actually have some others going on too, but one of them is for a private group at Holy Family Church next week. Considering everything that's happening in that town, they invited us in, and then we're doing a lot for many town employees around different towns within our community. So if anyone is interested in bringing that in, definitely reach out to either myself or Laura, and we can help set that up. And the only other thing I wanted to add about the More Than Sad program, after we deliver it at the school in the 3 parts, we actually leave the video in the whole program with the school. Because the teachers will go through the training with us the first day we meet with them. So that's one of the things, you know, the program itself is valued at, the film alone is valued at $70, and we do leave it with the school system.
Great. I'm just going to put we'll send out the slides with the contact info, but I'm trying to put it in the chat. Yeah, I think it worked. But we'll make sure folks get that as well. Sheila Flaherty had a question, which I don't know if you know the answer to. I know you're not a call center. Yeah, but go ahead, Sheila.
Yeah, I was just curious with the new 988 number, more people utilizing that, do you know, as opposed to the older number? I was just curious.
Yeah, so I think when it started, you know, in the first few months, the call center, you know, numbers went way up. Jenny might have some percentages. But yes, it is being utilized. It was, you know, heavily advertised or, you know, or spread around before it came out. So people heard about it, and it is being utilized. I think, Jenny, did you have a statistic you had that there were a certain percentage of uptake?
Yeah, I don't have a current one, but within the first 2 weeks of 988 being implemented, the call centers received 300%.
Wow.
Just in calls. And it wasn't that people were necessarily in crisis. And that's what a lot of people don't realize, that you don't have to be in crisis to call that number or to text it, because you can also text, talk, or speak to the 988 or the 741-741. But the amount of calls that they received were 300% than prior years at that time.
Oh, that's awesome. It's good. And you're seeing that number a lot out there, you know, on the news or talk shows. So it's a good thing. It's good. It's good to let the-
Massachusetts is actually a little behind on really promoting it. And there's a reason behind it. We're actually doing it in steps, because I'm sure a lot of you's heard about the mental health behavioral health centers that they're opening up across the state. There's going to be 25 across Massachusetts that offer even more resources for people. But until all those get up and running, we're actually not even putting it in print yet. We can talk about it, but I can't hang any posters yet or anything, even though if anyone wants them for the schools, I can get them through SAMHSA. So let me know and I'll be more than happy to provide them. And then actually, this says me, but this isn't me. I don't know what it is, Laura. It might be because you're under my account, but we also provide, this is really big that's happening, is problem gambling and suicide prevention, especially with all the gambling that's happening now in Massachusetts with the sports betting that's going to be coming live. Every time I have the TV on, I see at least 5 commercials within an hour about gambling. So that is a new program that we offer. Laura and I are both a couple of the trainers for that as well too.
Yeah, I see Kevin Hart. I know Kevin Hart better than I know my family members. He's on TV.
Agreed. Agreed.
Yeah, they're really pushing the sports gambling, and we already have a problem. That's another problem. It's not talked about much, but there's a huge gambling problem, you know, I mean, nationwide, but you know, in our concern in Massachusetts, there is. It's something else that gets kind of swept under the rug.
Absolutely.
But you know, it's an addiction, just like drugs and alcohol, to a lot of people. You know, Jenny and I have done a lot of work with elder services and all around Massachusetts, not just in our county. And it's a big problem with our elder community, which Jenny and I didn't realize until we, you know, started working with them. So all this advertising and easier access, especially to sports gambling, it's a real fix for people. So, you know, I think it's a concern that we all should look at with all the mental health work that we do, and see how we can incorporate it into even getting that, talking about it, even bringing it up going back to the schools, I mean, getting it into the schools with these kids who, you know, they start working in their, you know, sophomore, junior years. And, you know, I watch them, some of them are in my other business that I do, and we watch them spend money and gamble regularly. So I think it's definitely something that we all should keep an eye on and see how we can incorporate it together.
Yeah, I believe, and I know when the lottery expanded, the legislation required additional gambling addiction prevention funding, and I believe the expansion into sports betting and online betting it required an additional preventive spending too. So we can certainly find out more about that, and hopefully there'll be more resources available for gambling addiction prevention. So
We actually do have a lot of flyers for different scenarios. We have I'm drawing a blank on what it is. Laura, help me. If they're fact, basically resource pages, and we have them for college. We have them for the general audience. We have them for people suffering from Parkinson's. I mean, that they have an increased rate of gambling and suicide. We have the one for older adults. We have a separate one for women. So if anyone wants any of that information, I have about 15 boxes of them in my storage unit. More than happy to distribute them. So reach out and let us know.
awesome, thank you. And I see Brittany has put in the state's roadmap for behavioral health reform. There are flyers there about spreading the word about 988. So please take a look at that website. Thank you, Brittany. Any other questions or comments?
I just want to thank Jenny and Paul for their
helping to conduct a training tomorrow at Bridgewater State University for first responders. And it's been amazing. We've already got 55 people signed up, which is 5 over what we were what we thought was capacity, but we're going to try and do other trainings to follow that up. But I think there's just such a need with that group. So I just wanted to thank Jenny and Paul for helping with that.
Thanks for including us. It's important work. We're
Yes.
glad to be, we'll be glad to be there. I will see you tomorrow.
Yes, thank you.
Well, Paul and Jenny and Laura and everyone who's here from the coalition, thank you so much for the work you're doing. Thank you for sharing that with us. We will make sure that we get the contact info and those slides out to folks as well. It's obviously really important work, and we appreciate the fact that you're doing it and sharing it with us. At this point, if anyone has announcements, we have 2 quick announcements that I wanted to make, but I'll throw it open to the group first.
Mike, I did have one announcement to make. Judy Dewar, I also work for Plymouth Public Schools. Judy mentioned the Hope Day Walk that's happening on April 29th. I know I announced at the last meeting, but Plymouth Public Schools is having a health and community safety fair on Saturday, April 29th. We're still taking nonprofit vendors to sign up. So again, if you're a nonprofit organization that is aiming to hand out resources to adults and families, the demographic of people that usually come have small children, usually age birth to 5 years old, because we partner with PFN, the Plymouth Family Network, for younger kiddos. But there are a lot of adults and parents that walk down the community resource strip. So if you have not already signed up to have a table, some of you on the call already have. So I am going to put a link to a Google form in the chat. If you would like to sign up for a table, we're taking registrations until April 7th, I believe. It's a Friday. But just wanted to make that quick announcement. Thank you.
Awesome. Thank you. Anyone else?
Yeah, well, one thing I forgot to mention, Jenny and I are putting together Mental Health Day in coordination with Massasoit Community College in Brockton. So we're looking for vendors, for all of you to come out and, share your information if you can. If you want to have a table there, with your resources, that would be great. We don't have a definite date yet. Well, that'll be probably figured out by I guess Friday or so. So if anybody's interested, contact Jenny, and we'd love to have you there.
Yeah, if you want to get that, if you have like a solicitation flyer or anything, Paul or Jenny, get that to us. Be happy to share that with folks.
I'm
Yep,
working on that now, so definitely.
Dora, do you want to talk about the early childhood fair? You just put.
Yeah, sure. I mean, we already shared it. I believe that I asked him to share it. I just wanted to kind of give it one more plug. It's not really my program. It's just my coworker's program. She runs the South Shore Family Network, and she's super excited, and it's going to be a lot of fun. She's having Big Ryan's Tall Tales there, and Debbie will have her STEM activities that she does with the kids, and it should just be a good time. So if you're looking for something to do with the little ones this Saturday, come on by. It's from 10 to noon at the Kingston Elementary School.
Awesome. Thank you.
Thank you.
So I'm just going to quickly share this flyer. I think we're pretty well subscribed on this, if I'm not mistaken, Karen, but the virtual grant writing workshop, the first one is happening Wednesday, March 22nd. Alluded to, and I've said it at previous meetings, but our finances being in the state that they are, we're not as able to do grant making and grant giving as we had been in the past. So we're really excited and thankful to BID Plymouth for sponsoring this grant writing series that's happening at the next 4 months. And you see the dates there. And I know Kim sent this out. We can send it out again. Karen, how's the subscriptions. I think you're pretty full, right?
Yeah, well, so I think what I'm gonna do, instead of cutting off viewership, run them as a webinar.
Okay,
So we might not have as much time for questions, but I'm thinking that this might be better because I've already got 54 people signed up for the first one and, almost 40 for the other one. So obviously there's a need, and we were finding that as well, Mike, that, there's just a need in the community for organizations to be able to apply and receive these grants to stay sustainable. So we're definitely gonna, keep the registration open, and we'll probably just end up running them as webinars, as opposed to kind of a question and answer type of thing.
awesome. So Karen's contact is on there. We did send out the flyer if you have questions. So people can still go to those links and sign up for the webinar. Is that right?
Mhm.
Okay, perfect.
Yep. Yeah, it's a registration through Zoom, and then they'll get the Zoom link from there.
Okay, perfect. Thank
And
you.
I also have, and Kim helped to coordinate, we have the ASL interpreter coming as well, so.
Great. Awesome. Thank you. Two quick announcements. I already talked a little bit about the community health worker convening that we are working on. There'll be more details about that very soon, I think. I think we'll have a date by the end of this week, if not sooner. We're looking at the end of April for that, and pretty sure it's going to be happening at South Shore Health's facility in Rockland. So we'll get information about that out to folks. And I talked about the annual meeting on June 14th, and at our annual meeting, we will also be giving out our health literacy awards, the Liz Hahn Health Literacy Award. So if folks have nominations to make for that award, I know Kim sent out the form. We are looking for good candidates, for folks who have increased awareness about health issues, who have done work to remove obstacles to health literacy, to taking down barriers to health, positive health outcomes. There's a whole bunch of categories, but people who are doing good work should be recognized, and we really want to hear about them and celebrate them at our annual meeting in June. So the nominations are open until the end of April. I think it's right around the same date as Kelly's Health and Wellness Fair, if I'm not mistaken. So please do take a look at that form and think about good candidates for the Health Literacy Award. And I think that's all I have. If there are no other announcements. Kim just put the Health Literacy Awards in the chat, so thank you, Kim. So, well, thank you all. I would entertain a motion to adjourn at this point. Kelly, is there a second? Karen, thank you. All right, folks, thank you so much. We will see you in April at our next meeting, and I think we're going to have a presentation from Harbor Health, the PACE program. So we're looking forward to that. And keep an eye out for emails on our Facebook page for announcements about all these good programs that are happening. So thank you all. Have a great day.
Thank you.
Thanks, bye.
Yeah.